DDS, Mastering the Uniform Hospital Discharge Data Set. Okay, a foundation guide for study inpatient data reporting, clinical standards, and hospital reimbursement system established by US Department of Health and Human Services, this HHS, to standardize the data collection. So, in end of the day, the two things we are going to do with this UHDDS. One is like payment, to standardize the payment system. Okay, so the end of the hospital, the patient who was admitted in the hospital as an inpatient, they may come up with some conditions, they may occur with some conditions, and in the end, during the discharge, they may come with some conclusion. Okay, so based on these all three scenarios, okay, we are going to come for a conclusion. What would be the payment? How much we need to pay? So to provide that payment, we need a standardized data. Okay, that standardized data will be provided by Uniform Hospital Discharge Data Set. They collect the information, they gather the information, they analyze the information, they analyze the indicators, they analyze the principal diagnosis, secondary diagnosis, and a discharge summary all together. Okay, based on that, they may end up with the payment. Okay, so what type of payment should be gone? So it's just not for only the procedure you are going to pay, it is for the payment going to be concluded based on the reimbursement is going to be concluded based on the principal diagnosis and the secondary diagnosis and other indicators and modifiers used along with the procedures. Okay, so on that base, what are the things we are going to follow in this? Okay, so as we discussed earlier, established by the United States Department of Health and Human Services, defines minimum data element reported for every inpatient hospital discharge. Very mandatory for all the inpatient hospital discharge. We are not using this at any cost for the outpatient. Applies only to the inpatient hospital stay for standardized reporting, used data reporting, quality measurement, reimbursement, and research. The point whatever we are already discussed. Then core UHDDS data elements. So one is like patient demography, the other one is which is going to be the hospital and provider information. Okay, so these both are very mandatory, very important thing for important core elements for following the guidelines and coming to the conclusion for the payment reimbursement system for the inpatients, especially for the inpatient. So which are like patient identifier, age, sex, then race, ethnicity, residency. These are the important data which need to be there. Then along with that, we need to check for the hospital identifiers and attending and operating physicians, admission source and discharge status like alive, expired. These all are required for the elements required for the UHDDS. Uniform, what is that? Uniform hospital. What is that? Luna, can you remember?
Yes.
Uniform hospital
Discharge
discharge data set.
data
Okay,
sets. Yes.
remember. Okay, uniform hospital discharge
Discharge
data set. Okay,
yes.
so based on that, the purpose, as I told, consistent in inpatient data reporting, accurate principal diagnosis selections. Okay, that will ensure this guideline will ensure accurate principal diagnosis, reliable drug related grouping. Okay, medical severity, drug related grouping assignments will be there, which is a comorbidity condition or which is like major comorbidity condition. So this all will be indicated with the help of UHDDS, then comparable national health statistics. So that will provide a data like based on your discharge summary, they will come for a conclusion what type of patient status is there that can be tracked with the help of UHDDS. Support for the quality measure and for the audits. It's very useful for the quality measure and for the audits. Okay. So in exam point of view, it is used in inpatient or hospital discharge only, not used for the outpatient or physician office visit. So that is the main purpose of this UHDDS. Then required, what are the elements required? So previously we have seen core element. That core element is further segregated into three, that is patient demography, clinical data, administration data. So those elements are patient identifier, that is like MRN patient ID or visit number, like that, something need to be there. Date of birth, sex, race, ethnicity, and residency. And here, principal diagnosis or other diagnosis, which is secondary and principal procedure, other significant procedures. Okay, key rule, diagnosis must be clinically significant. Okay, and date of procedures. These all are very mandatory for the clinical data. Third is like administrative data, which is like admission date, discharge status, disposition, attending provider, facility identifier. These all are very mandatory for the UHDDS. Then definition, so which is like affect the patient care, conditions that affect the patient care, increase the length of the stay, and required, okay, requiring the evaluation and treatment for monitoring, affect the nurse care or resource. These all are the conditions which are required for the secondary diagnosis as per the UHDDS. So we are talking about secondary diagnosis. Secondary diagnosis. What is now secondary diagnosis? Okay, a condition established after the study to be chiefly responsible for the patient admission to the hospital. Okay, after the hospital admission, after the principal diagnosis, any other conditions which are affecting the patient or making the patient to stay long in the hospital, or which is need further diagnosis or further treatment or further observation or monitoring, or it is affecting the nurse care or resources, other resources. These all conditions together, which is implementing for the secondary diagnosis as per the UHDDS. So principal diagnosis is a condition which is a reason for the admitting in the hospital as per UHDDS, and the secondary is the condition which is making the patient to stay long, take additional care, and make the additional evaluation. These all are, if it is happening as per the UHDDS, as per the UHDDS guidelines, that will be considered as a secondary diagnosis. So that is a major difference on the principal diagnosis and the secondary diagnosis. Okay, so again, principal diagnosis, additionally some point. So established after the study to be clearly responsible for the admission, determined only after reviewing of the entire record, then reporting allow only one principal diagnosis per stay, and exam trap. Okay, diagnosis at the admission is not always a principal diagnosis. So don't imagine during the admission, whatever the condition is there, I cannot assume or I cannot think that is a principal diagnosis. Okay, so here a small definition for the little more elaboration on the principal diagnosis. So these all are the criteria which we need to be very ensured. So the main and important thing here is like the yellow highlighted exam trap. Diagnosis at admission is not always a principal diagnosis. Remember, okay, we need this criteria. Okay, the condition established after the study to be clearly responsible for admission, determine only the review of entire documentation, report allows for only one principal diagnosis per stay. Remember. Then context on the secondary diagnosis and procedure. So condition coexisting at the admission or developing during the stay must require evaluation, treatment, and extended stay. Okay, so reportable procedure, it all significant surgical, non-surgical act, report requires the specific date of the procedure. So depending on that, for the secondary diagnosis also, they may go for the additional procedure. So for that procedure, whether the procedure is performed for the secondary diagnosis or principal diagnosis, based on the procedure date, I will be able to conclude. Okay, so conditions, okay, some of the conditions exclude from the coding. Okay, do not code conditions that were ruled out. Okay, so which are the conditions I need to exclude? Okay, additionally, so when it comes for the secondary diagnosis and primary diagnosis, where I don't want to consider, those are the conditions you don't want to consider, means do not code the conditions where already ruled out. Ruled out means it is removed. Ruled out means entirely removed. Okay, that is what rule out is different. Ruled out is different. Rule out means I have found it. Okay, I have found it. I am going to find it. That is what a rule out. That is a present tense. Ruled out means it is already finished. So don't go for further on that. Okay, do not code the ruled out condition. Exclude conditions documented as suspected only. Exclude the conditions documented as suspected only. Do not code the condition that did not affect the patient care. Don't code the condition that did not affect the patient care. Okay, so cannot just blindly take the secondary diagnosis. Certain conditions which will not affect the patient means I don't want to code that also. Why I'm coding the diagnosis? Because it is affecting the physician. Why is it affecting the patient? Why I'm segregating that into the principal diagnosis and secondary diagnosis means the weightage, the payment weightage will be there. Principal diagnosis is most important. Secondary diagnosis affecting the patient. For both, I need to go for, cannot go for the payment, where only for the principal diagnosis, I need to go for the payment. For the secondary diagnosis, I will be indicating where I can take additional care for the secondary diagnosis for the patient. Then condition documented as history only, unless impacting the care. So all the history conditions you cannot take. Okay, breast history cancer or other history cancers you cannot take. If that conditions is affecting the patient currently, then that can be considered. Then small difference on UHA, like inpatient and outpatient. So UHDDS, okay, it's a data set. So code principal diagnosis, there we call it as primary code or first listed diagnosis. Okay, based on the impression, based on the level, like that only we'll be able to take the code. Okay, so here Ruled out conditions, code, ruled out conditions. So rule out conditions, code, ruled out condition, do not, rule out condition, do not code. That is what I told. Ruled out is different. Rule out is different. Here, rule out, yes, I can consider for the inpatient. For the outpatient, I cannot consider. Okay, so because presently they're talking about the condition. That is why it became the inpatient. Here, rule out means they're going to identify the diagnose the condition. I will not be able to consider for the outpatient. Then primary label, principal diagnosis. Here, primary diagnosis or first listed diagnosis, which is been seen in the impression. Principal diagnosis is the condition reason for the admission of the inpatient. Then additional criteria required, not required, and PO indicator required, not required. Okay, so additional criteria means whether the other conditions, the clinical indicators, clinical features are needed. Yes, it is definitely needed. When it comes for the outpatient, it's not required. Based on the impression, I will just code the condition and I will go. PO indicator, yes, I need to tell whether it is in during hospital admission or hospital acquired condition. Those indicators I need to indicate with here. It is not required. Okay, so this is the major difference between the inpatient and the outpatient. Okay, for the based on the UHDD guidelines. Yes, you are clear here.
Yes, sir.
Okay, so 1 minute.